is Paige Weaver, the wellness manager at Baylor Scott and White Health, and also wellness coordinator who will be working on site with Hall for the rest of this year and into next year. And so I'm super excited to be working with this population. You'll know that this will be available for record it too, as well as every other webinar that we do. We have a YouTube channel, and I can send you all the information there if you want to access this afterwards or share it with anyone. It is part of the White Wellness program being offered at Hall Park, and we have a couple other things going on in addition to the webinars. We've got some on-site events planned for every portal that you have access to, where you can log in and create your account and take an online wellness assessment. And there's also some online digital health coaching if you're interested in that. And then the last thing I wanted to mention is that within the on-site events, we will start to offer wellness, one-on-one individualized wellness coaching for those participants interested in that. And so if you want any more information on any of the offerings that we have going on throughout the year, email me. The address I can share it at the end of the presentation. It's corporate wellness. It's all one word. whealth.org. And we're interested in working on and helping them get there. A little bit about me. And then I thought what we could do is here going over throughout our time today. I do the different types of stress and the effects of stress on the body, and just kind of talk about some of the common questions I get from my wellness coaching participants. And then a minute to assess your stress level with tools, stress reduction. And then at the end, I plan on playing a minute stress reduction technique exercise recording. So we'll get to at the end. We would start with some trivia. This is just going to be some common things that people think about stress. So the first question here, and I don't have a poll or anything set up, so you can just kind of think in your mind what your answer may be. So it can be linked to gray hairs. Do you think that's true or false? A lot of, oh my God, you're causing my grays, but it's actually false. That stress can turn your hair gray. However, it's true. Stress can cause hair loss. Can begin up to 3 months after a very stressful event. So that's kind of interesting. Hair to physically suffer from a broken heart. Is that true or is that false? It's true. It occurs in women. Emotional trauma can lead to broken heart syndrome or stress cardiomyopathy, which is just severe heart muscle weakness. This heart syndrome is called octopus trap cardiomyopathy because the left ventricle balloons out in a peculiar shape. This is news to me. I had no idea that this was even a real thing, but it's kind of interesting, just the research behind it. Next is stress can cause ulcers. Is it true or false? True, but ulcer is not caused by stress. H. bacteria or the use of enzymes cause the ulcer. However, stress can make them worse. Maybe not make them worse, but they can keep them from healing. So stress is definitely plays a factor with ulcers. True or false? Noises can cause stress and other health problems. True. It's called acoustic stress, which is triggered by loud noises. And estimated that this causes as many as 3,000 deaths in the U.S. each year. If any of you are interested in the research of the study behind these, I can definitely provide those. I just thought these were super interesting. Okay, is more prone to developing stress-related illness. When I first saw the question, I thought, well, surely it's females because we tend to take on a lot more responsibility and other people's worries and all that, and we're just maybe sometimes more sensitive than men. One, what's the proper definition of stress? A, B, or C? It's our physical and mental reactions to change. And to include this on here is because I think we assume that stress is always bad, and that's not necessarily true. If you can just kind of channel it into a positive uplift, we're going to talk about that too during together. So this guy, Hans Selye, is known as the father of stress, and he defines it as the body's non-specific response to a event placed on it. And I will say one of the things that's difficult about stress reduction as part of a wellness program is it's so important. If it's going through a stressful time, or if they're dealing with a lot of stress, it's very, very difficult to focus on other areas of self-care, such as nutrition, exercise. It's hard to get there when you're dealing with something super simple. And each person's reaction to stress is so different, which it's very individualized, and what works for one person may not work for another person. So we find it works for us to try and reduce our stress. And the difference between good stress and bad stress. And conception stress is always a bad thing. It's not necessarily true. There's a happy place between being calm, being distressed, and it's this place where you're experiencing eustress. This is actually shown to improve our performance, but the level of stress increases if it starts to quickly work against us. A quote that kind of illustrates the point that I'd like to share with you. Stress is like spice. In portion, it enhances the flavor of a dish. Too produces a bland, dull meal, and too much of it may choke you. So there's a little food for thought. There's this right amount of stress called eustress. So it's achieve more and can also improve chances when you're working through a problem. Proven that finding the right stress balance is good for your brain. Researchers found that while chronic exposure to high levels of cortisol, which is one of the stress hormones, managed the hippocampus, can actually enhance learning and memory. So I'm sure a lot of you have experienced this before. Maybe you're excited about something. It's, really looking forward to something like this, let's just say vacation. There is this amount of energy that you experience, and it's, I would say that's kind of where that eustress kicks in, where you have energy and you're just excited about something. That kind of stress is that good stress, that eustress that can actually be beneficial to your health. It's the fight or flight response at some point in your life, maybe at some point today. But our body deals with this short-term isolated stress in the fight or flight response. And so that is a good thing. It's your body's way of protecting itself, and it assists with you dealing with danger or trying to get out of a sticky situation. But when we're operating in that mode for too long, that's when problems arise and can be detrimental to our well-being. Flight response is supposed to be short-term. So, like I said, those chronic health issues or maybe noticeable side effects would start to happen if you were experiencing this for a long time. And so, attention to this image here. I'm sure you all have experienced this at some point, but so the noticeable effects of the fight or flight explanatory. You start sweating, you get this, and your breathing changes, your muscles tense. All these hidden effects that are going on that you may not know. Your insulin is released. There's a cocktail of stress hormones that are released, and they cause different physiologic responses. For example, your blood pressure rises, digestion slows, and there's all this stuff going on that is noticeable to you, but then there's another layer of things going on that you may not notice. And so some health problems that have been linked to high levels of cortisol are, I'm sure most of them, high blood pressure, high sugar, low system response, depression, anxiety, and obesity. And when I'm coaching, when I'm doing wellness coaching, I've gotten this question before. If we're talking about weight management, I'll get the question, is the stress part of why I can't lose weight? Briefly touch on this because stress does have negative effects on the body, and it's in two ways. So the first way here is metabolically. Brain sends a message to your adrenal gland to produce the hormones that help you deal with stress. So like when your fight or flight response, again, cocktail of hormones is released, and hormones can have an effect on your body weight. Those are ACTH, adrenaline, and cortisol. In some cases is when people are stressed out for long periods of time, hold on to weight specific in their abdomen, which this isn't the case for everyone, because I also know people who, they get stressed out, they tend to lose weight, who wouldn't like that problem. But truly that is an issue for some people. Their appetites are gone and they just self to eat early because they're dealing with something, they lose weight. But on the other end of the spectrum here, you have this metabolic response when you're stressed. Layer of how stress affects the body is behavioral, and I'm sure maybe some of you have dealt with this in the past, but the endocrinologist Riccardo Perfetti, to further complicate matters, the fuel need during fight or flight is sugar, which is why you may tend to crave carbs when you're stressed out, because our body can convert carbs to sugar. And so if you're thinking, if you're struggling with weight loss and wondering what the culprit, definitely could be if you're experiencing some type of stress in your life. Again, if y'all have any more questions about that or would like to talk about in more depth one-on-one, feel free to contact me. That's kind of where my passion and I'd love to talk with you. So just let me know. You can call me, 214-820-6824 is my office number. All right. Okay, I'm super stressed out. I've got a ton going on. I barely have time to listen to this webinar. And so you might be thinking, I think I'm doing pretty good. I don't know. Well, let's use this here to assess your stress. So your score interpretation is here. So let's see what happens. Tool that we'll be using. It's called the Holmes and Rahe Stress Scale. Questions to answer. Way for y'all to do this. I'm just going to go through it here, and then I'm going to email y'all the presentation, and after you can access the link in order to get here, or you can Google the Holmes and Rahe stress scale. Take it and know where your stress level is. So see what they've kind of set all of these different types of stressors a score. And so see here, there's some really, just to that not all stress is bad. There's some really fun things here, like or pregnancy or this might not be good at changing lines of work, So see, these are all considered stressful events. It's just some are good and some can be bad. So the Rahe scale is what you'll take to determine the level of stress that you're experiencing, and then interpretation. So if you're under 150, you have only a low to moderate chance of becoming ill in your future. to 299, you've got a moderate chance of becoming ill. And then if it's over 300, you have a very high risk of becoming ill in the near future. And way, I think the scale is interesting, and it's kind of eye-opening just to take that and think about what you're currently going through and think about how it might be affecting you. But there's an easier way to know how to assess your stress, and this chart helps. So these are some stress warning signs and symptoms, and they're broken up into 4 categories: cognitive, emotional, behavioral, and physical. And take a minute here, I would say, and just see how you're dealing with currently. Have a little caveat here. Many of you are having any of the following: feeling dizziness, rapid breathing, racing heartbeat, if you're able to function at work or at home or at your job, if fears that you really can't control, or just irrational fears, or a traumatic event, I just would highly recommend that you reach out to someone in your life, or maybe your EAP, because those are just things that you really don't want to ignore for too long. All right, and aside from working with a professional, there are things that you can help alleviate your stress if kind of part of those normal life stressors. And I'm going to share a 6-step process on how to deal with some of the stressors in your life. And with these steps, I'd love for you to try and apply them to a stressful situation that you're working through in your life. Thing would be to identify how to deal with your stress. So this is where it gets very, very individualized. I have a friend who she deals with stress, like it's a huge stress reliever for her to run. But I have a friend who says it would be super stressful for me to try to do that. I don't enjoy that. I don't want any part of that. No. I guess the thing to mention here is you want to identify the unhealthy ways that you cope with stress. And thing as simple as, every second that you have your smartphone, or you pull up some type of distractor, you don't really want to deal with what's going on. And, taking out your stress on others, waiting, under eating, kind of going back to what we were talking about earlier with the stress on weight. Obviously, there's a lot of unhealthy ways to deal. But as you know, a lot of these techniques are just kind of putting a Band-Aid on the problem, and they don't really solve them. So first, just kind of think about how you currently deal with your life. And then examine the sources of stress. This is going to become a no-brainer thing, but just when you think about it in the 6-step process, hopefully it'll work through some issues. So this would be examine your sources of stress. The stressful situations would be super easy to identify, and maybe some aren't. And this takes some reflection, where you kind of sit and find a quiet spot and just kind of think through everything that's taken up space in your life, in your thoughts, your emotions. So write your stressors. Obviously, you'll want to focus on the stuff that you do have control over. So maybe separate them between those that you do control over and those that you don't, which I know it's a lot easier to say, oh, I'm just going to keep in control. Easier to say and do, but that's just a tip that is helpful for some. And then if you want to avoid unnecessary stress, this includes paring down your to-do list, avoiding negative people, situations, maybe topics. If you're at a day, maybe you don't want to hot topics, such as politics, especially right now, religion, relationships, things like that. You want to kind of try to avoiding the drama, I guess, is what that means. And managing your time. That's another thing that I'm able to talk with people about during wellness coaching would be time management and just kind of how to structure their days. They're able to be productive and feel like they're getting accomplished what they need to get accomplished. And so if you're kind of on the fence about what coaching is and you're interested in it, that's one other thing that we can kind of walk through. This is going back to the accepting things that you don't have control over. It's difficult. It is a pretty important part of stress management, because when you are able to kind of let go of the things that you can't control, that's a lot more easy to deal with the things that you can. This kind of just expands on the time. A lot of people, well, let's say not a lot of people, some people perform stress and they don't have to write it out and map it out and, you know, plan that, but others really do well with making a plan, whether it's getting one of those time management sheets off the internet where it's Monday through Friday, you know, 6 a.m. to 10 p.m. kind of off periods of time where you can maybe do stress reduction or just find out which areas are taking up a lot of your time, work through that so that you aren't causing yourself more stress. And then also treating your plan with respect. I mean, what I mean by this is that stress is truly just another part of self-care, really, is taking care of yourself and making sure that you are giving yourself some me, which is stress management. It always makes me think of that visual when you're on the airplane when you have to put your mask on first before helping people. But I mean, it kind of all ties into that. If you're taken care of and your needs aren't being met, you're going to help other people as you can. And so really trying to make this piece of your life a priority. People ask, you know, how much do I have to do, or how do you do this so that you know, hopefully it'll start to have a impact on your stress levels. And what the American Institute of Stress recommends is perform some type of stress reduction technique for at least 10 minutes each day. And one of my friends loves running. Well, that one is like, no way, I'd much rather read. That's much more stress reducing to me. So finding what works for you, and then working through just a variety of techniques to see maybe that's out there that you haven't tried that really stress relieving that you don't know about yet. For example, one thing that helps calm me down and just a crossword puzzle, and that's something that's kind of non-conventional, but it just, there's something about just having that puzzle to work through that really helps me bring a level down when I'm having a rough day. Some and true stress reduction methods that maybe you haven't heard of before. Right here, the first one is chocolate. I know that sounds funny. There are studies that show that the noise, which can boost the immune system. And stress hormone. So have your wellness coach's permission to have a small piece of chocolate a day. Included here what a serving size of dark chocolate would look like. About 2 ounces, and you do want to make sure it's dark because it contains the flavonoids, those antioxidants. And I would love for you to start to try to do is to laugh every day. Yes, about 450 times a day. And then on the other opposite end of the spectrum, they laugh about 15 times a day. Laughing can lower the stress hormones and strengthen the immune system by releasing health-enhancing hormones like dopamine and all the hormones, your emotions. And I would encourage you to find something that makes you laugh and to practice that daily. Another interesting stress reduction technique that there have been studies on is knitting. Probably has something to do with, you know, how when I'm doing my crossword puzzle, it's just kind of something to focus on, that necessarily anything that's really going on in your life. There was a study done at Harvard Medical School, the Mind Institute. They found a reduction in of 11 beats per minute. So the heart rate went down 11 beats per minute when people were knitting, when they were doing some other activity. And it's also been shown to decrease blood pressure. So if you need any ideas on start with stress reduction, these would be a few. What would a wellness be without mentioning exercise? I know it's typical. I know you've heard it so much, but this is kind of interesting. Those who were allowed to exercise as much as they wanted to on a free running wheel showed severe or fewer fight or flight responses to a painful stressor compared to those in similar cages with a fixed wheel. They had lower levels of stress-related hormones and reduced sympathetic nervous system responses. So, I mean, we all know, we've all heard it, exercise helps reduce your stress. And I just encourage you, it doesn't have to be running, it doesn't have to be swimming, it can be anything that you enjoy, getting your heart rate elevated a little bit. I'll talk about this mindfulness and meditation, especially in the last 10 years or so. I mean, it's been around forever. It's kind of become a hot topic lately. But there have been several research studies done on mindfulness meditation that lower people's stress. So I would explain it is